So we've got to 2 minutes past 10, so hopefully people are joining us as they're available. Thank you everyone for joining this travel and transport session. We're group 1 of 2 groups. We're here to hear from 6 innovators in the next 90 minutes. So thank you very much for joining us. Our sessions are automatically being recorded. As Pete mentioned, they'll be made available for delegates after this event. So if you have any trouble, just turn your camera off and mute yourself. That would be fantastic. Our innovators have been asked to present for about 15 minutes each, and we'll aim to stick to those times so that we hear from them all within the next 90 minutes. If you have any questions, as Pete mentioned, please try and use the question function in Teams or add them to the chat. If possible, highlight which speaker your question is for. That would be a great help for us administering this with answers, and we'll be capturing questions for circulations with answers after the event. Fantastic. So our first speaker today is Antonia Roberts from CoMoUK, and fantastically Antonia's here. And Antonia, are you able to share your screen with us?
Yeah, let's give that a whirl. 1 second. Okay. There's a slight delay on everything. But
I'll tell you when I see it. It's not come through for me yet, but that could be a slow internet day.
Yeah, I can see everything's just like a second delayed from when I'm doing things. So
fantastic. Over to you, Antonia.
Can you see? Cool. Oh, okay. Morning, everybody. Welcome. Thank you ever so much for inviting me to this event. Really nice to be a part of something that's so innovative and interesting. So my name's Antonia Roberts, and I work for CoMoUK. And assuming most of you won't have heard of us, CoMoUK is short for Collaborative Mobility. We're a charity. We've been around for over 20 years, and we are exist to support the development of shared transport. And shared transport is a collection of lots of different activities, car clubs, bike and e-scooter sharing, lift sharing, demand responsive transport, and often all brought together under mobility hubs, which is a kind of new innovation that's happening in the UK at the moment. And we support this sector through carrying out research about the different activities, how they can support the environment and our communities. We collect guidance around these activities, and we also host events like this, bringing people from public sector and private sector together to kind of learn more about how to make these events a success. So today I want to particularly focus on car clubs and bike sharing, and see how these particular initiatives can help to support the objectives of the NHS and health providers. So starting with car clubs, basically car clubs, if you haven't heard of them before, it's about access to a car rather than owning a car. And it differs from car hire in the fact that you are accessing the car via an app. They're usually based where you need them, so in the community or at a workplace. You unlock it using the app, and you just pay for the kind of the use that you use. So your finances aren't sort of tied up in owning a car. There are over 5,000 different car club vehicles across the UK, with over 350,000 people actively using these schemes. And these are just some of the operators that are out there delivering these services. So you might think cars and environment, they don't tend to mix. Why is a car club an environmental initiative? Well, it's about the fact that if you don't have all of your assets tied up in owning a car, you're freer to use the right type of transport for each journey. You can assess that as you go along. So people don't default to the car on their drive, and they think, okay, it's more appropriate for me to use public transport, walk or cycle for this particular journey. They tend to do that more than the national average for those reasons. And also it means it's more efficient use of fewer cars. So we typically see each car club car can reduce the number of cars on the street by around 20, a factor of 20. And also those vehicles tend to be cleaner, they're newer, the carbon emissions are lower, there's a much higher percentage of electric vehicles. So we have around 10% of car club vehicles are electric, as opposed to only 1% of the general population at the moment. So drilling into how this can help to support NHS, and particularly looking at how this car club innovation can support replacement of grey fleet. I've divided into this kind of 3 areas: so cost reduction, risk reduction, and environmental impact reduction. So if you think about the amount of time and effort and cost that would go into managing grey fleet expense system, that would just be eliminated. Would it be managed by the car club itself? So the vehicles would be conveniently situated around the different facilities. People would use them as they need them, and the use of that by each particular individual and department would automatically be, recorded and managed through those systems. There's also a cost reduction because there isn't the same incentive to use your own car. There's no kind of cloudy kind of area in terms of the fact that you're using a staff resource there. And also there's a cost reduction from not needing so many car parking spaces. So land is freed up for more useful purposes. The risk side of things is important because there's no need for people to kind of think about the reliability of the grey fleet, because the car club is providing newer, reliable vehicles, and it is doing all of those checks and cleaning, etc. for you. Environmentally, as I was mentioning, the vehicles tend to be newer and have lower emissions, but also there's kind of general incentives for behaviour change as well, because people don't need to necessarily bring their car on the commute into work. They could use the sale modes to get into work and then pick up a car club car to do any kind of business trips that are needed. So it encourages that shift and it gives people a choice, especially if other initiatives are going alongside it. So I've got a couple of quick case studies on the car side of things. This is a nice quote from York Teaching Hospital. So the car club is enabling us to reduce costs, meet our sustainability objectives, and ensure our people are driving safe, modern cars. We're finding that our employees are driving fewer miles also. And they also say that the data that they're provided on their business trips is enabling them to create a comprehensive travel policy that promotes car sharing, reduces mileage, and ensures employers only take trips that are absolutely necessary. And this is from Enterprise Car Club, who provide the full service for the foundation there. Second example, we may hear more of shortly from HiyaCar, who are presenting this morning as well, and they provide the technology that alongside a different fleet provider. So a lot of the car club providers can either provide the whole solution or just the technology side of it. And again, there's really nice kind of feedback there about improvements in efficiency, cost savings, and being able to kind of shift to meeting wider objectives. Moving on to bike share, I think this is also a really important area for consideration here. So again, this is about access rather than owning a bike. It could be a complement to ownership. Lots of people that use bike share also own their own bikes, but it's about where bikes are available in pools for people to access where they need them. Quite often they're app-based self-service on street schemes, but there can be lower tech kind of solutions in terms of pool bike schemes within workplaces as well. Here's a few of the providers that are out there at the moment, and just an idea of the scale of bike share that's out there at the moment. I'm sure you've kind of come across these different schemes in different locations across the UK. And again, just to kind of emphasise the benefits of bike share, particularly as opposed to cycling, just traditional ownership of bikes. There's a real kind of bank of evidence to show that bike share helps to encourage people that haven't cycled before to get back into cycling. People tend to use their own clothes. You don't need to think about looking after the maintenance, storage of bikes. All that kind of worry is taken away from you. All you're doing is kind of pitching up and using the bikes and paying for just what you use. And they're very supportive of multimodal journeys. It's a big part of bike share is to pick up bikes at rail and bus stations and do that kind of onward travel, which again could be really helpful in this context. So bike share can help to connect people to work, like I said, from public transport, but it could also be something that could be used to connect people between different sites as well. And it's obviously having all of those benefits of people getting fresh air, exercise, you know, and low carbon activity. It's a good way of saving money as well, because you know, not everybody can afford to buy a bike, or especially an e-bike. So it's you know, it might be more affordable than owning a bike, and it just gives people that alternative to taking the car. When they want to have that change. And there's again, you know, perhaps a space saving because you don't need so much parking space for cars and bikes. So again, a couple of case studies in London. A company called, well, they were called Human Forest. They've just rebranded as Forest, providing discounts for NHS staff for them to use the fleet of bikes that are across the region and across that area when they're travelling between sites and to work. And the second study, case study, is in Glasgow, where not only are they providing discount memberships, but they're also providing bikes at actual different key locations, these 6 different locations in Glasgow for the NHS staff to use. So it's kind of focusing on what is the actual provision that's needed there too. So that's me. I just want to kind of emphasise, you know, we're here to kind of have further conversations if that's useful. We have, I can put in the chat in a second, a couple of different links. We've got an employee action kit, which might be useful, and we've also got a collection of further NHS case studies, which might be useful. Always happy to kind of have ongoing conversations, because I think there's a real opportunity here for NHS to save money, as well as having a, you know, lowering the environmental impact. And that's my contact details.
Fantastic. Thank you, Antonia, for walking us through that. And yeah, please do pop your contact details in the chat for anyone to reach out to you after. And if anyone has any questions for Antonia, please do use the Q&A function in Teams. Fantastic. So up next is Thomas from Pollution Solution to talk to us about your innovation.
Thank you very much, Amanda. I'll just share my screen now.
Fantastic. And I'll let you know when I can see it.
Thank you very much.
Fantastic. I can see that now, Thomas.
Great. So thank you very much for having me here today. So the theme of this presentation is to talk to you about air quality in and around hospitals. So my name is Thomas Delgado. I'm the CEO and inventor behind RoadVent, CEO of Pollution Solution. And we have patented technology that effectively captures and cleans pollution that leaves vehicles. So why is this relevant to the NHS? I will talk you through this now. So a brief overview of RoadVent and our technology. So we have technology which you can hopefully see here on the screen, which consists of a fairly simple system, 2 linear slot drains that we installed into the carriageway, so into the road, that are actually connected with a pipe or pipes to a roadside cabinet. This roadside cabinet creates suction in the carriageway and also filters the dirty air that's captured. So RoadVent has been independently and scientifically verified to reduce human exposure at the roadside by 91%. So this is significant air quality improvements we're talking about here. And the reason it is so effective is because it's positioned as close as possible to the source of the emissions. So we are capturing both exhaust gas and, of course, particulate matter that leaves exhaust, so the dust that crosses the blood-brain barrier, as well as brake and tyre dust. So these are all well-known, very dangerous substances that are causing a whole host of issues in terms of illnesses and, of course, increased mortality, unfortunately. So this is now available for installation at hospital docking bays, and I'm here today to talk to you about some other case studies that we're working on in the real world too. So the system itself consists of, as I said, a roadside cabinet, which is connected with a pipe or a series of pipes to linear slot drains that are installed into the road. The installation takes 3 to 4 days and can be installed fairly quickly, so within 2 to 3 weeks in terms of notice, in terms of the supply of the product. And as I say, we're looking at installing this now with the NHS at multiple sites at hospital docking bays. So where the ambulances pull up, queue for some period of time, and then, of course, unload patients. So how do we do this? How do we actually filter the air? Because this is really important. So the dirty air is obviously captured into the slot drains that you've seen on screen there, and then it passes through a series of filters. And on the screen here, hopefully you'll be able to see, we use a wire gauze mesh, an electrostatic precipitator, a MERV 14 rated HEPA filter, and then impregnated activated carbon, and of course an acoustic enclosure and a silencer. So what this does is it actually provides almost medical grade air quality that leaves the top of the cabinet as a result of this filtration. So the efficacy that I spoke about, well, we've had independent testing conducted by a team over in Cambridge, headed by Dr. Mark Peckham. And the result of that study found that, as you can hopefully see on screen here, when measuring air pollution at the roadside, so we're looking at NOx in particular, NO and NO2, as hopefully you can see on screen here, the left-hand side of this screen shows you what the exposure was to the sensor at the height of a child's head. So this is measuring at a height of 1.2 meters. And on the left-hand side, you can see with this road vent system turned off, the level of exposure in parts per billion for NOx on the left-hand side here. And then on the right-hand side, the level of exposure with road vent turned on. Now, hopefully you can see the huge stark difference here, but this is not just about the overall average reduction. This is about mitigating these spikes and peaks that we so often see in the real world. Of course, this is a high priority to many in terms of mitigating this exposure. And I'm just going to show a very short video here, which shows you exactly how this system works. So hopefully you can see the video, which I'm just about to play. And as you can see, hopefully, the system effectively sucks in this pollution into the channels, which are then pumped away into the cabinet and cleaned at the roadside. So this all happens instantaneously. And as soon as the system is turned on and activated is when you see the air quality improvement. So this is not something that takes days, weeks, or months to bed in and create an impact. And now just very quickly, a short snippet of the system in real time. So again, this is actually an elaboration of the graph you've just seen, but the top half of the screen shows you exposure at the roadside with the system turned off, and the bottom half of the screen shows you exposure at the roadside with the system turned on. Multiple scenarios using different vehicles, all real world stuff, so this is not lab testing. And as I say, the overall impact is a 91% average reduction. So back to the presentation. Why is this important for the NHS? Well, of course, before I move on to that slide, indoor air quality is obviously inextricably linked to outdoor air quality, certainly in and around the facility of the hospital. So since we've launched, we've had quite a very good amount, I should say, of academic endorsement and support, which you can find on our website. But some names that have endorsed us and offer support to us in terms of the science behind what we do. To name a few, Professor Frank Kelly, who you may have heard of from Imperial College London, as well as Sir Stephen Holgate. Why is intervention needed by the NHS? Well, queuing ambulances are a known issue. And since we've launched and presented this to the NHS, I've been out myself with our construction director and completed many site surveys at NHS portfolio buildings. And what we see is unfortunately very similar situations at every site. Often queuing ambulances, as well as other elements that create this problem of air pollution build-up in and around the hospital. So what do I mean by that? The architecture, so to speak, is the main problem. So it seems every hospital we've looked at has a canopy, as can be seen here on the screen. And for patient comfort and obviously safety, these ambulances reverse up and often sit there idling for patient comfort. So ambulance drivers will tell you, no, we do turn the ambulances off, and they're always clearly working in the best interests of the patients. However, often they have to leave the engines running for patient comfort in terms of heating on cold days, and of course the opposite on hot days with the air conditioning running, as well as keeping the machinery running on board of the ambulance. So often it's not a case of not wanting to turn the engine off, it's a case of not being able to turn the engine off. And this, coupled with the canopy and big, large sliding opening doors, creates an emissions build-up outside, which unfortunately creeps into the hospital and creates poor air quality inside. As well as that, we have the fleet vehicle specification. So large, generally large 3 or 3.5 litre engined Mercedes or similar Citroen Fiat vehicles. Many of these have higher mileage and have covered a lot of usage over the years, so they're not as efficient as they may have once been. Adoption of EV ambulances, again, this has been spoken about quite widely. However, it seems the adoption is not quite there yet. And of course, there's a massive cost in terms of fleet change to get from where we are now to where we need to be, which is, of course, non-emitting vehicles. And in 2019, the NHS did spend just over £36 million, believe it or not, on some new diesel ambulances. So again, a lot of cost involved here in changing. And as you can hopefully see from the bottom left-hand picture on the screen here, every ambulance actually has 2 exhausts, one for the heating system, one for the vehicle's engine. So unfortunately, the level of emissions is actually is very high and more and higher, I should say, than most vans of a similar specification. So what happens if we do nothing about this problem? Well, there's many implications. Just yesterday, the EU voted to make air pollution an inextricable right, human right, and actually allowed or opened up the law to public citizens to sue the government in the case of exposure. And now this comes in 2035, but we have seen class action lawsuits very similar to this, kind of starting to open up elsewhere. So clearly, there's many significant risks to the NHS in not doing something about this problem. To name a few, Health and Safety England, of course, the cost regulation. Then we have employers' liability to staff. Not only that, and again, quite worryingly, some of the sites that I've been out to survey have vulnerable patients sat in the hospital very close, in fact, very close proximity to where these ambulances are emitting these emissions. And of course, as a result of that, there's potential exacerbation of health issues and increased mortality rates. So the legal costs and financial claims that could come from this are very significant and have been seen elsewhere in other situations. So a bit of an update in terms of our progress. This is hot off the press. We are now working with multiple local authorities throughout the UK, and by local authorities, I mean councils, who are looking to install road vent at hotspots. So slightly different use case, and this is where we have roads or streets of significant buildup of traffic and it's affecting residents that live nearby and or business owners. But this is really compelling. So Professor Paul Lewis is a UK clean air champion. He approached us and said that basically the Welsh government had asked him to look at mitigation strategies for solving a problem area in Wales. And to get to the point, he looked at 3 mitigation strategies, as you can hopefully see from the right-hand side of the screen here at the bottom. Anti-idling scheme, so asking people to turn their engines off, diverting HGV in buses, and then finally road vent systems to mitigate this exposure and bring the levels down to a legal level on a road in Wales. And currently this road is illegal. And hopefully you can see from the bottom right hand side of the screen, anti-idling simply did not work. People don't do it often enough and they very quickly forget. Diverting HGV and buses did work. However, the massive caveat to that is that, of course, these HGVs and buses had to go elsewhere, and as a result of that, reduced the air quality elsewhere. And then finally, road vent. Well, road vent didn't cause vehicles to drive elsewhere. They continued as normal, but what it did do is bring compliance to that road as a result of the installation of the road vent system. So again, hot off the press, really, really compelling data here. Why is road vent the right solution for the NHS? Well, of the sites that I've looked at, it seems that we have continuous problems in very similar situations. So just to talk about a few, queuing ambulances, of course, the canopy situation where these ambulances queue and create this tent-like build-up of pollution that I've just spoken about. Road vent can solve that problem very, very quickly as a turnkey solution. But not only that, we often have queuing patient visitor vehicles at barriers and multi-storey car parks. So again, we're really keen to talk to you about how we can help improve air quality outside, and as a result of that, improve indoor air quality. And I've spoken about this at quite some length already, but once it's deployed, it's instant, it provides tangible, measurable improvements. And the way we do that, the way we quantify that is by having an air quality sensor installed prior to the installation of the road vent system. That gives us a baseline, and then when we install this system, of course, we have this significant reduction afterwards, and then that creates some really tangible data that can be used for annual reports, and we can also speak to academia. We've got a huge amount of interest with regards to quantifying that into improved patient outcomes, improved staff health, reduction of days off as a result of staff being healthier and not suffering from respiratory issues and so on and so forth. So we'd love to speak to you more about this. As I say, it's a widespread issue at many sites across NHS portfolio buildings, and we can help, and we'd love to help. So please do get in touch.
Fantastic. Thanks, Thomas, for walking us through that, and very brave trying to do a live video demo as well. So well done on the success of that.
I hope it came through clearly. Thanks.
It did, absolutely. There's one question in the chat for you as well, and if anyone has any more questions linked to pollution solution, please do add them in the Q&A or chat function. Fantastic. So Tom, are you able to stop sharing, and then hopefully Beau, our next speaker, can talk to us from EMSOL.
Thank you.
Indeed here. Thanks, Amanda. And I'm going to bring up my screen here in just a second.
You're a little bit hard to hear, Beau. I don't know if...
Oh, right. I'll try and speak up. I'm not sure what's causing that.
Can hear you, but very quiet.
Right. I will speak very loudly in that case.
Fantastic. That's better.
Yeah, that's better. Okay, excellent. Let me share my screen here then. And it should have now popped up.
Yep, I can see that. Off you go, Beau.
Fantastic. Well, thanks so much to the AHSN for inviting EMSOL today. We're really happy to be part of this session, and really interesting to hear a lot of the innovation that's going on and all the different work that's taken place. And of course, very excited to speak with the NHS professionals that are joining the call and share what we're doing with EMSOL with a variety of NHS trusts. For those that don't know EMSOL, we are an emissions management company. We've been going around 6 years now. We work with a variety of organisations. So while we work a lot with the NHS, we also work with retail companies, we work with local authorities, we work in waste management and construction as well. But for any organisation that we work with, we're helping them to understand two main things. The first is, how can we help this organisation understand hyperlocal pollution trends? So really help them to spot where they are in pollution terms, looking at PM2.5, PM10 and NO2, and how those trends adapt over time. The second piece is where we really specialise, and no matter the organisation that we work with, what we're looking to help them understand is, what are the causes of pollution events? So what is going on at a hyperlocal location around a hospital site? What activity is taking place that's causing a real big spike in pollution? So this is real-time pollution. So we can look at, in the space of a 1 minute or 1 hour, 1 day, when are there big pollution spikes that we're trying to understand what's behind those? So it's that second piece that we really focus a lot of our time on, looking to gather those insights and then take mitigating action against those, so that trusts can really evidence the actions they're taking to reduce pollution around their hospital sites. Now, why is this important to the NHS? I probably don't have to go into too much detail around this, but there's some really clear stats around the impact of air pollution on hospital sites. Thomas from Road Vent, I think, shared some great examples there just a moment ago in a previous presentation. So to add to that, studies have shown that 246 hospitals are in areas where air pollution are above the WHO's limit for PM2.5. We're looking at a third of GP surgeries and a quarter of hospitals there. And then, of course, there is that huge financial cost as well to the impact of air pollution. So we're increasingly seeing a real big focus within a variety of trusts, not just in urban areas, but also some in semi-rural areas where they're saying, right, we need to get a better understanding of pollution around our sites and how it's impacting patients and staff. As a result of that, I should add as well, we're seeing, you know, the emergence of things such as clean air plans to support green plan initiatives among a number of different trusts. And of course, we were well aware of green plan targets as it relates to air pollution. In terms of a number of common challenges that we hear, so I won't go into too much detail on this, but in speaking with, you know, dozens and dozens of trusts over the past year or so, we've come to understand a few common themes. The first is that a lot of trusts really don't have the data to understand the causes of pollution spikes or pollution events. Now, a lot of trusts might rely on some monitoring from the local authorities. There might be, you know, diffusion tubes in place, you know, some sensors nearby to the hospital site, or there might be some kind of average, longer term average pollution sensors in place. And those are really fantastic in getting an understanding of baseline pollution levels. But once you've gathered that data, it still doesn't tell you what's actually causing that pollution activity. So that's a real big challenge here that we see for trusts is they've gathered the data. What can they then do with that data? Efficiently addressing pollution breaches is another major issue. Of course, I imagine there's a lot of sustainability managers on the call today, a lot of estates managers, procurement professionals as well. There are so many different things that sustainability is focused on at the moment within the NHS that it's hard to spend a lot of time on one specific area, and pollution is one of those areas that sometimes gets a little bit neglected because of those time constraints. So that's another challenge that we look to address at EMSOL. Evidencing green plan targets. You know, there's an increasing number of trusts now that are adding pollution targets within their green plans. So setting targets for, you know, NO2 and PM2.5 and PM10. Still in the early stages for the vast majority of trusts, but a number of those are getting there. And actually evidencing those targets can be a major challenge. And then the final piece is monitoring and reporting the impact of third-party supply chain. Of course, there's huge efforts in this space when it comes to tracking mileage and carbon as a result of a third-party supply chain. But actually looking at the impact of suppliers that visit hospital sites, that's something that's for the most part, we don't have a huge amount of data on. Most trusts don't have a huge amount of data on. So where does the EMSOL technology come in? Well, I mentioned before that we look to take things one step beyond traditional pollution monitoring. So as I said, most trusts will rely on local monitors or have no monitoring in place at all. Where there is data that's gathered, it often looks, you know, something like this top level bar, which is useful baseline data. You can see, right, where are we, you know, where are our pollution levels when it comes to things like PM2.5, NO2 and PM10. The problem with that is, one, those averages, even if we are below certain legal requirements and WHO air quality guidelines on specific days, those averages will conceal major pollution events and pollution spikes that we know are really damaging to patient and staff health. And the other challenge there is when we get days, hours, minutes where there is a big pollution spike that we have identified, there's a lot of guesswork involved in what might have potentially caused that. We might think it was due to congestion around a car park. We might think it's because there's high ambient pollution drifting across from a nearby carriageway. We might think it's because there's lots of suppliers visiting the site at that time. But there's a lot of guesswork involved there. So how EMSOL looks to address this is really quite simple. We have a number of deployments at the moment across NHS trusts, as I said, a variety of both urban and more rural trusts. And what we do is when we're speaking with these hospital sites and sustainability managers at trusts, estate managers at trusts, what we look to initially understand is where do they suspect are some particularly polluted sections of their hospital site. And often we come across a number of kind of common areas there. One might be the delivery areas and loading bays where there's lots of supply chain activity, lots of heavy vehicles coming in there. Another might be congested car parks, of course, with everyone working on their green travel plans at the moment or having recently updated green travel plans. a big focus on getting more staff to take alternative means to work other than cars. So a real big focus there around car park congestion. But there's also a variety of other areas and hospital sites there where pollution monitoring can be very useful. And of course, Thomas alluded to that as well with ambulance bays there. It's another kind of highly polluted area. But what we do once we've identified these polluted areas, and you can see on my screen here an example of one, this would be a delivery bay. What we do is we install air quality sensors in place to understand real-time pollution levels. So we're looking at, as I mentioned before, PM2.5, PM10 and NO2, so real-time monitoring of those pollution levels. And then we set thresholds with the trusts based on their guidelines. So we look to say, right, what are nearby ambient pollution levels and how should we take those into consideration? What are some of their long-term pollution targets? But setting those flexible thresholds so we've got an idea of where we are. Now that's kind of step one, and that's all very, very, very simple and very standard. And a lot of companies out there do something similar, to be honest. Where we look to take it to the next step is what happens when those thresholds are breached. So let's say, for instance, we had an NO2 breach at 9:30 this morning in the delivery bay. What happens is it triggers an alert in our software platform. It's a really intuitive platform to use. In the NHS client set, we have numerous members of staff are signed up, not just within sustainability or estates, but anyone that has an interest or a stake in air pollution around the site. It will create a pollution alert in the system for 9:30 a.m. We had an NO2 spike in the delivery bay. And what that alert does is it triggers the other piece of hardware that we've got on site, which is a camera overlooking that key activity area. So what you'll often then see is particular trends that relate to these video insights that you get, because we capture the minute prior to the pollution event occurring. So you're seeing a time-lapse video of 60 seconds prior to that pollution event, what was happening in the delivery bay that might have caused this major NO2 pollution spike at 9:30 this morning. And you'll start to see some common things there. You might see, okay, there was overcrowding. There were too many suppliers or contractors coming and using this loading bay at the same time. And it was causing an NO2 spike. You might see things such as idling vehicles. You might see things such as waste collection or delivery that's going on and it's kicking up a lot of dust for if we had a PM10 spike, for instance. But what you start to do then is you tag those pollution events very simply within the platform. So we've got very simple kind of auto select tagging system to build out a picture. So this pollution event was caused by this particular supplier idling their vehicle at this time. You might also see that every 2 weeks when a particular supplier comes to site, we get the same pollution spike. So let's make a note of that supplier. And the idea there is all of those tags build to creating an overall report at the end of each month, where you can start to get a breakdown of, right, in this month, what were the top 4, 5, 6 causes of pollution events in our delivery area or our loading bay. And then you can start to take actions against those. Now, it's not just the delivery area or the loading bay. This is where most of our deployments are at the moment, because there's some real simple mitigating actions you can take when it comes to discussing with your supply chain. But as I said, we're also looking at car park monitoring. As you think about all of the idling that goes on with queues to get into car parks or drop-off areas in car parks, there's lots of trends that we need to understand and data that we need to gather to make the case for changes that will support green travel plans. So in terms of what can be done, I'm just going to go on to the next screen here. So we've seen a variety of countermeasures as a result of the insights that we gather through our platform. As I mentioned, trusts that we're working with are now equipped with the real data, the insights to understand what was causing pollution spikes. So measures can range from as simple things such as no idling signage through to quick ad hoc discussions with suppliers, real-time mitigation where one of a member of staff that's working in the loading bay or near the delivery area has had a real-time alert come through and is having a discussion with one of the drivers there around not idling. all the way through to actually building in pollution control requirements in procurement contracts. So I've brought up the example here of Guy's Hospital in London. Guy's and St Thomas's have been one of our longest term clients. And they've now actually set guidelines to say that whenever suppliers are bidding for contracts, they have to commit to certain pollution standards when delivering to site. So as part of their bid process, as part of that tender, they have to make certain commitments. And it's a way of holding suppliers accountable to say, right, we've committed to this as part of the tender process. We've noticed a couple of spikes, a couple of issues as your vehicles have come to site. How can we work together to make sure that doesn't happen in future? So a real kind of range of activities that can be done based on the video insights that we gather there. But the idea there, of course, is over time, as you start to tackle those, high pollution events, those major pollution spikes, you'll get less pollution spikes relating to the thresholds that we've set. So we start to bring the thresholds down further and further. So you're then tackling the medium high pollution events and then the medium pollution events, and then demonstrating improvement over time, evidencing that in our platform where you can see the change in pollution levels in PM2.5, PM10 and NO2 over the course of a year and over longer term periods as well. I'm going to put my details in the chat as I wrap things up here, along with a link to our website where we have a little bit more information on our work with the NHS. So I'll put in two links in there. But we're always really keen to speak with trusts to understand how are they thinking about tackling pollution on site, because there's so much variety with how trusts are tackling the issue. So really, really keen to speak with as many people as possible, as many trusts as possible, to build a big picture. So if you do have any questions or would like to get in touch, please do email me after the session today. But that's everything from my side. So thanks so much for listening, and I'll hand back to you, Amanda.
Fantastic. Thanks so much for that, Beau. Thanks for walking us through that. And as Beau mentioned, if you've got any questions, please add them in the chat or the Q&A function. So our next speaker, we were expecting to hear from Mark Hand from MobilityWays. From people, I can't see Mark with us, so I don't know whether to call up our next presenter. Sorry to put you on the spot, Sam, but it's Sam Dewhurst. You're with us to speak from HiyaCar, if available. Oh, it looks like we've encountered one of those technical difficulties where we're a speaker short and our next one's not quite ready yet. Do we potentially have Daniel from Knowles Fleet with us?
You do, yeah. So what I'll do is
Fantastic.
Sam's got the slides, so what I'll quickly do is I'll give him a call and ask him to come online now.
Fantastic.
Lovely, thank you.
Thank you for jumping in, Dan. Very helpful.
No problem, one moment.
This is where we need that Teams music again, isn't it, to cover the silence.
And there he was. Sam, all ready for you?
Morning.
Fantastic. Hi, Sam. Sorry to call you up early, but if you're ready to give your presentation for HiyaCar, that would be fantastic.
Yes, of course. I'll share my screen.
Fantastic. I'll let you know when I can see it.
Is that all good?
I can see that. Yeah, I can see that now.
Great stuff. Well, thank you everyone for joining us, and thank you to the HSN network for putting this event on. My name is Sam Dewhurst. I am the business development lead for public sector for HiyaCar. A bit of background about me: I joined HiyaCar about 6 months ago from being the transport manager for one of the largest community NHS trusts in the country to sort of help deliver this product to create more sustainable fleets within the NHS. So I'll just hand over to our partners Knowles Fleet, and Dan will introduce himself.
Yeah, thank you, Sam. So Dan O'Neill, Commercial Director, Knowles Fleet, and we provide independent fleet administration services across the public sector, including NHS, councils, and other government departments. And we're working with HiyaCar to provide an outstanding solution, which will reduce the carbon footprint significantly.
Great stuff. Thanks, Dan. So you're probably wondering, pool card solution, what exactly is it? So we heard from CoMo a bit earlier about the power of car clubs. Essentially, we are providing the technology to NHS Trust to enable to create their own sort of direct car club. So it's born off 4 key pillars. So the first pillar being our booking platform, which allows users to view and book vehicles at the different NHS sites they are based on. Aside from this, we have our keyless vehicle access. This prevents staff having to go and find clinical staff on a break or find a key, someone's took it on holiday. It's all done via remote keyless access, which is conducted via Bluetooth. In the background of this, we have 24/7 support. So we support multiple NHS trusts, 365 days, out of hours nursing teams throughout the night. If any issues with the car, any issues with the tech, any user error, any breakdowns, we are there on the phone or on live chat to help with that. And in the background of that, you will get access to something called the Fleet Administration Portal, which is where you'll be able to see all of your vehicles listed, live locations, pick up, drop off images, as well as any servicing and MOT details, all the stats about the vehicles. We provide you full access to that, which also allows remote access to the vehicle. So if you're working from another site as a transport manager or someone who looks after the vehicles, you can remotely access them vehicles to let a maintenance engineer, let a valeter in remotely. So you can unlock the vehicle from your desk or from wherever you are, really. So talking more about reducing vehicle emissions across the NHS. So it all depends on how your current fleet looks like. There's 3 sort of models that NHS trusts seem to use. So that's the grey fleet. Obviously, we know Agenda for Change currently pays 59p a mile. However, with Agenda for Change and the petrol prices increasing, this is coming increasingly hard on staff in regards to filling up their cars to do business miles. And the other issue with grey fleet is you can't control emissions. Although companies like Knowles Fleet offer great salary sacrifice and lease deals on vehicles, not everyone can access these, and you can't control the emissions that people drive. Car Club is another model that some NHS trusts use. However, this is usually by suppliers providing the vehicles, whereas we, in partnership with Knowles Fleet, like to ask the trust to provide the vehicles or provide the vehicles via Knowles directly, who can access CCS framework pricing, which creates a huge cost saving over a car club provider providing the vehicles. And then if you're just running pool cars, typically this is either done on an Excel spreadsheet or an Outlook calendar. The issues with that is you lose keys, you don't know actually who's booked the vehicle, someone's booked it but hasn't put it on the calendar. You have big issues with that, and especially in regards to reorganizing fines and anything like that. Our system sort of helps deal with all of that. So from grey fleet, you can sort of reduce your emissions by up to 22% and costs by up to 80%. From the car club, obviously you get to choose your vehicles, which Dan will go into in a second. Cut emissions by up to 10% and cost by up to 50%. And if you've got existing pool cars, we're looking to reduce costs by about 40% by increasing utilisation. So how is this work in regards to creating and instilling change within the trust? We all know change doesn't come easy, especially in NHS trusts, and there's a lot of hoops to jump through, and we sometimes do get a lot of pushback. But it's all about creating a strong policy, ensuring the vehicles are used in a proper way to gain efficiencies and gain that sustainable factor. And sort of to include in that policy is all about electric vehicle charging, license checks, eligible users, and all about departmental sharing and pool car over grey fleet. And we offer that service. We help NHS trusts, and we have in the past creation of policy to instill that sharing culture. So I'll just pass on to Dan to talk more about grey fleet control.
Lovely, thanks, Sam. So if you look at travel as a whole across a typical NHS trust, the largest proportion of emissions will be conducted via what we classify as a grey fleet, so privately owned vehicle that's used for work. There's no limitation on what vehicle can be used. So we've had cases where vehicles are 20 plus years old, still being used on a regular basis to do business travel. But on average, we're finding now it's about nearly 8 years old. and is emitting 145 grams of CO2 and travels 2,800 business miles per annum. So there's a lot of carbon that gets emitted from that. So before any organisation can really tackle that, we need to first ascertain where we are now. So what we could provide is a grey fleet management system which centralises everything for the trust. So before any user can be reimbursed for business travel, they have to go through our central register, which enables us to have information on the vehicle that's being used via interface with DVLA. So we get information on the age, the fuel type, and the emissions that are being emitted from the travel. And then we'll also cover off all the duty of care requirements as well. So if someone's doing business travel on behalf of the trust, you've got duty of care to make sure the vehicle is properly insured, including business cover, and that an accurate license is held as well. And we'll also do daily MOT and road fund license checks via an API with the DVLA to ensure compliance. Once you've passed that, all mileage that is undertaken goes through that system. Because we've then got the business mileage that's been travelled and we've got the exact vehicle details, we can provide you with a carbon analysis report, and that can be done on a monthly basis following the submission of the payment information into ESR. Sam, next slide. Lovely. So just to sum up, the key 5 things you need to do is understand the exact vehicles that are being used for work so that we can then get an accurate profile. Make sure the duty of care requirements are checked so that if someone doesn't use a pool car, they're still fully compliant. And then with the mileage information, we can actually capture key journeys that are being undertaken. So if a high proportion of the users are all traveling from one site to another, we can deploy pool cars at both locations so that staff can access them instead of using their own private car, and then we can see the emissions drop as a whole. We'll do that via the annual carbon reporting as well. So when it comes to year end and you have to do your annual report, we'll provide you a high level analysis of everything that's been undertaken and the savings you've done by utilising the pool car scheme. And if you did the lease car scheme at the same time, we provide that analysis as well.
Thanks, Dan. So looking at more about reducing vehicle related costs and emissions via the HiyaCar platform and via pool cars in general. So how you can see the savings there from grey fleet compared to pool vehicles in regards to costs as well as the tons of CO2 saved. But how are these savings created? So looking at different NHS trusts we've worked with, some have small pool fleets and large grey fleet. So we look at that and say, actually, if you get more pool vehicles, you can actually reduce that grey fleet bill and the grey fleet emissions. However, some trusts have really large pool car fleets. However, they aren't actually getting utilised to the full potential. So what you'll find in some trusts is different teams. So whether you've got community OTs or community nurses, out of hours team, crisis teams, they'll all have their subset of vehicles. If them vehicles, for example, have been used for the day, a staff member might either get in their own vehicle, so you can't control the emissions of their own vehicle, either get a taxi, so can't really control the emissions of taxis, or that they are slightly getting better, but you can't control the cost of taxis, or even worse, get a daily rental at £150 to £200 a day. And to get an electric vehicle from a daily rental provider is quite scarce. So how we operate is we have something called markets, which you can set these vehicles, and these staff can have access to these markets. So it creates a sharing culture of the vehicles. So people can have access to different teams' vehicles when their vehicles aren't available. If the vehicle's off the road or it's got a flat tire, and they usually get a courtesy car or a rental car, they might have access to other vehicles on site, which are usually used by different teams. It's all about increasing that utilisation. So what I'll do is get Dan to talk about the CCS framework and how we achieve the sort of the price benefits over sort of our competitors in regards to car clubs, but also over grey fleet.
Lovely, thanks, Sam. So with the Crown Commercial Services, framework that gives public sector organisations such as yourself access to a panel of providers to all quoting using the same terms and conditions of use. And because everyone's quoting for the same exact vehicle with the same exact terms, the only difference is price. So what we can do is we can select the cheapest price from one of the 17 different leasing companies that are providing pricing to the public sector, and utilise the same manufacturer terms as well, which CCS have negotiated. And in some cases, that can be as much as 35 to 40%. So the actual discounts that you can achieve are significant. If you compare that to what we can get as a private sector lease, you'd be talking hundreds of pounds a month difference between the two. So to combine that buying power with the technology from HiyaCar to use as a pool car, will mean you'll save, I think it's about 40%, isn't it, Sam, in comparison
Correct,
to
yeah.
other car club providers? So
Great stuff, thanks, Dan. So you see, yeah, as Dan's got into, just an example there, via CCS, an electric pool car would probably cost around 23p per mile versus agenda for change of 59p per mile. And obviously you've got your CO2 impact on as that as well. Again, another cost saving, reduction in damage costs via our technology, via the pickup and drop off images, and more control over violations and PCNs tracked more effectively, because you'll be able to see a full record of who's driving the vehicles via our face rec technology, and then the likes of Knowles will be able to pass that directly onto the driver, rather than the trust not being able to identify who the charge is for and then having to pay them themselves. So just a case study. So we've worked closely with Norfolk Community Health and Care, a really large community NHS trust based in rural Norfolk. So they had a previous car club provider who they had around 25 vehicles with. We looked at the actual usage of these vehicles and the locations, and I helped them identify, look, if these vehicles are shared more effectively between more different teams and more different users, you can actually reduce that number to 19. So creating a cost saving and emission saving via that. It was across 6 different locations. They had a 38% reduction in grey fleet mileage, £140,000 saving in year 1, which is a 58% reduction in costs, and an increase up to 70% in live vehicle utilisation. And then the CO2 saved is around 6 tonnes. So you can see the benefits of the system, and how it's not just about one pillar of grey fleet, it's about utilisation of existing fleet, a sharing culture, and this all creates the sustainability aspect, as well as your duty of care to staff. As we know, petrol prices are increasing. You have the cost of living crisis. Staff, especially in the lower bandings, find it harder and harder to fill up their cars at the start of the month and carry out business mileage. So offering a zero emission pool car scheme is sort of a win-win. You're saving the costs over grey fleet. You're offering staff something more efficient to them, something they don't have to necessarily pay for, and then also getting the carbon saving benefit from that as well. So moving into sort of some frequently asked questions we get when we talk to NHS trusts. I'll let Dan talk about the sort of why the trust should provide the vehicles and the difference between vehicle purchase and lease.
Yeah, so with the trust providing the vehicles that I touched on previously, you'll have access to some significant public sector terms. So as an organisation, you've got a couple of choices. We can assist you with an outright purchase of a vehicle. So if it was you going to hold the vehicle for long term potentially, or you had some additional funding revenue that's been received, then you could use that to buy a vehicle outright. The tech can then be fitted to the vehicle in the same way as it would be for a conventional contract hire. And then you'll just record the asset on your registers. We'll provide full assistance as well with any accounting treatments that need to be undertaken, and confirm any VAT liabilities as well. When you take the vehicle on lease, it will be on a standard contract hire, and everything will be wrapped into one. So you won't need to have any concerns about the estimated residual value, say at the end of the period of requirement. And if anything was to change during the contract and you needed to maybe return the vehicle, then you do have the option to do so. And again, you've got the outstanding terms that the CCS frameworks bring to the table.
Great stuff, thanks, Dan. So moving into sort of how the costs are broken down. So you have a few different costs. So the tech install, monthly subscription per vehicle, cleaning and maintenance, which you can provide, the lease cost and fuel for the vehicle, and the trust vehicle insurance. So that is all broken down into the figures we've gone over previously. And from some of our competitors in regards to offering a car club, you can receive the 40% saving and such a saving over grey fleet. So big savings on costs and emissions. So you're probably thinking, how do we actually know how many vehicles you need to reduce grey fleet and offer an excellent service? So a good tech provider will analyze your grey fleet data. So look at the trends, look how many miles you're doing, look at the sites, look at the staff numbers, and then sort of identify how many vehicles you might need from that via past experience, ensuring cost and emission reduction, providing details on utilization, which is key, identify where vehicles can be better shared across sites and staff groups, and highlight where vehicle numbers can be reduced and increased. So that's the key things you should be looking for. In regards to delivery process, we're looking to help Trust determine fleet and size requirements, and then obviously with our partners Knowles, we can retrofit to any existing vehicles you have from any other suppliers. But with Knowles, if it was a completely new scheme and you was getting pool cars, they'd offer the personal shopper exercise, which I don't know if Dan, if you want to just quickly come in on how that works.
Yeah, so with the personal shop, and anyone transitioning to an electric vehicle is going to have a hesitation if they've never driven one before, or they're not entirely sure if they're going to be able to drive it, so they haven't driven an automatic vehicle, for example. So what our teams do is we host personal shopper calls via Microsoft Teams. So someone will book a call, just a quick 10 to 20 minute session, and within that, what we'll cover off is their EV readiness. So we'll take into account their location, where they, what type of property they have, and what type of journeys they do. Because what we're finding more and more is that people are hesitating to make that transition because of the 1 or 2 journeys they make, which are quite long in the whole year, and they're not considering the 99% of the time they'll only be doing local travel. So we grab that, and then what we can do from there is provide them with suitable vehicle options that meet their needs.
Great stuff, thank you. So in regards to the sort of what delivery process looks like, so take you through them first 2 steps: gather the driver information and the vehicles, and then install our quick start technology. This plugs straight into the OBD port. We don't touch any wires, we don't void any manufacturer warranty. It's quick and simple to install, and it's non-intrusive. We then upload the drivers to the system and prepare all our invitations to the system. In regards to the fleet, we provide training for the admins in person and online, provide policy help to encourage the best use and the best efficiency for the vehicles, and then help you create a custom comms plan for staff. Like I said, in-person driver training we provided on sites, as well as online driver sessions. And then in the sort of running of the system, HiyaCar will work closely with Knowles Fleet, if it was a Knowles Fleet, to ensure the fleet runs safely. And then drivers will be supported by our support 24/7. And usually the lead time, depending on vehicle availability, is around 4 to 8 weeks. So summary, so you get started with minimum effort and little to no upfront costs, save over 40% year on fleet costs, benefit from the CCS discount, give drivers access to the best in class technology, remove the need for third-party fleet management software, and obviously reduce your emissions as a whole. Now, I was speaking to NHS Net Zero a few weeks ago, and I just wanted to end on this really good quote that they spoke about. So, is it good healthcare if it's not sustainable? And I think this is what all the NHS trusts need to think about. We know budgets are tight. We know that there is issues in regards to sustainability budgets and funding from central government, but we always need to think about when making decisions, is it good healthcare if it's not sustainable? So if I just stop sharing and we sort of invite anyone if they've got any questions or want any more extra information.
Thanks for walking us through that, Sam and Dan.
Thank you.
There's no additional questions in the chat. I'm not sure if anyone has any live now. If not, we will move on to our next presenter. Mark Hand is with us from MobilityWays, and he will be our last speaker for this session. Mark, are you okay to start presenting?
I am, thank you very much. Apologies, first of all, if you get any background noise. I'm on an all-staff company day today, and it can get a little bit noisy in the background, so just apologies if that happens. Similarly, because I'm not on the rest of the session today, please do get in touch if you've got any further questions or want more detail, because obviously I'm going to just give you the overview for now.
Assuming I can see your slides. Yes.
You can, fantastic. Okay, thank you. So just to introduce the organisation first, MobilityWays are a social enterprise. We're celebrating our 25th anniversary this year, which is fantastic. During our quarter of a century, we've taken 1.6 billion miles off the UK road network. And we've recently spread our wings from what was a focus on car sharing into sustainable travel. Our reason for being is to ensure that by 2040 at the latest, the UK has achieved zero carbon commuting. So fairly ambitious for an SME in Norfolk, but I think we've got a good track record and we've got a clear strategy. And that involves, first of all, working with the largest employers in the country, which of course includes the NHS. We're already working with 40 trusts, but also in other sectors across government, MOD, private sector, Lloyds Bank, NatWest, Amex, etc. So part of what we do is about a focus on working with large employers, and the second part really is working hand in hand with government. So our approach and tools were included in the government's decarbonisation of transport strategy in 2021, and we are regularly meeting with the DfT to encourage them to deliver on their commitments that were made in that strategy. Now, our reason for being is that we are focused on transport and the commute. So transport's the biggest emitter in the UK now. It's not waste, water or energy. It is transport, and the commute is 5% of all of the UK's emissions, a whopping 18 billion kilos of CO2e annually. In the NHS generally, it's 4% of your emissions coming from the commute. But that can vary widely, and I've come across trusts where it's close to 8 or even 10% of total emissions, and obviously some that are a bit lower. In terms of the organisations themselves, and obviously in this instance we're talking about NHS trusts in particular, we'll often get approached either about a parking issue or a sustainability driver, and in fact it's much broader than that when we get into sustainable commuting. And if you look to the right of this slide, the operational issues that come out of those conversations could equally be when I'm talking to Amazon or NatWest or a government department. Yes, parking management may well be involved, and in terms of NHS, it almost always is. But we've also got addressing the cost of living crisis. In other words, helping staff to access the site more cheaply. There's a recruitment angle and a retention angle to this, which is really important, because if I can't afford to come and work at a hospital, then I'm unlikely to take a job. So if we are able at a recruitment stage to be able to share using one of our tools, a personal travel plan that shows prospective staff the options available to them, including potentially sharing with others that work at that site, then suddenly that becomes affordable. And it may well be we retain staff as well. And that's really important, because every time we have to replace a member of staff, the national figure for the cost of that is about £25,000. The other operational areas include wellbeing, mental and physical, air quality improvements, obviously that's now a statutory requirement, and patient experience and access. If we can start to shift the use of parking capacity away from staff and towards patients and visitors, of course it improves their experience. It also increases revenue to the NHS and a particular hospital site. And to give you one example, there's a trust that I'm currently speaking to, and we've undertaken the process I'm going to take you through at a high level. And we found out that 2/3 of the staff that work at that site actually live within walking and cycling distance. And 2/3 of the spaces available at the hospital are actually used by staff. So there's a complete paradox there, and an issue that needs addressing. Now, on the sustainability side, which of course is our main driver, this is about delivering on NHS commitments. It's about giving staff a way to make a difference. And that's really important. And many of us want to help. There's all sorts of examples this year, very sadly, and most recently, of course, in Libya, of the impact of climate. We're seeing it now. We want to make a difference, but how do we do that? Well, amending your commute is a very simple way, an immediate way that you can start to reduce your personal emissions and help the trust to deliver on its own commitments. What we're seeking to help with is a data-based approach to delivering green travel plans, and also providing data that enables trust to engage with partners in terms of improving access to sites. So I'll come on to more of that in a second. So what we've actually created is something under the brand MobilityWays, which is both a framework and a dashboard. It's a framework that helps large employers to be able to understand their current situation in terms of commute behaviour and the impact of that from the emissions perspective, and then how we reduce those emissions through changes of behaviour and constantly reporting on that as we move forward. And I'll go through a little bit of the detail of that in a second. But the second thing, as I mentioned before, this is as a dashboard, so that you're able to see at all times all data connected to commuting emissions and travel live on the dashboard. That's live data on the dashboard. So our approach is 3 phases. The first, the measurement phase. The first part of that, the use of the humble travel survey. Travel surveys are incredibly important, and they can be delivered really well, and they can be delivered really badly. And I've come across examples where response rates are very low, and as you dig a little bit deeper, you find out maybe 50 questions were asked, for example. Really doesn't work. But the travel survey is very important because it gives us and senior management teams an understanding of how staff are commuting, why they're commuting the way they are, what are the barriers to change, what incentives might help overcome those barriers. And what we can also do with some clever software is to convert that behaviour data into an immediate baseline position for you on your total and average emissions. The total emissions are really important because that's typically how you'd report back to Greener NHS in terms of how you're doing. Average is important because your employee numbers might well go up and down regularly. And what we want to see is that average trend coming down, because that's the real impact. And then the third piece of the jigsaw, and for me, the game changer, is what we call scoping. So this is an analysis of postcode data of employees that allows us to report very quickly to give the senior management team, again, an understanding of how staff can commute, not how they do, where the gaps in services and provision are, where do we have large clusters of staff attempting to get to work for the start of a shift who cannot do anything else than jump into a petrol or diesel car and drive alone to work. And what's the impact of change? If we're able to turn the dial on some of these modes, what does that mean in terms of climate change? What does it mean in terms of air quality, financial savings for staff, and health and wellbeing metrics? And we produce all of that within this report. And we also produce and provide for you 3 key maps. I'm just going to show you an example very quickly now, and this is a real example from Salford Royal in the Northwest, where we've used the postcode data, and these are postcodes, not houses, to look at 3 scenarios. One is around public transport, one is around car share opportunities, and one is around active travel, walking and cycling. So what you can see on the moment on the map is the postcodes for all the staff that work at the hospital, and you can see that here in the middle. The green dots are those postcodes in which staff live where they have at least one viable public transport option to get them to site at the start of that shift. Now, this is really important because it's showing potentially, if you use this data in conversations with transport operators, it shows them the size of the potential market. In this case, 58% of all staff had at least one viable public transport option to get them to site. Sounds really encouraging, doesn't it? But when we did the survey, we found that 3% of staff were actually using those services. Now, what we're able to do with this approach is to start, for you as an employer, to start to have a conversation with staff within these postcodes as to what are the reasons they're not using the public transport services, and to really dig deep into that. So then what we're able to provide in a conversation with a transport operator is not just the size of the market and the size of actual use, but what are the issues that need addressing in terms of bringing those together and better aligning the services to the needs of the staff. The second thing we can show transport operators is to the north here and to the south, you can see these orange dots, which are postcodes that have no viable public transport options. And you can see some very large clusters here included. Now, what that might mean is that the transport operator looks at that and says, is there a commercially viable way for me to actually amend or add new services that will mean that my market potential increases significantly? If they're not willing to do so, or it's just not commercially viable for them, what you can do as an employer is to start to look at perhaps electric shuttles that you may introduce. And you can see a potential route here, for example. Now, rather than just putting that in play, which is clearly expensive and at high risk, why not have a conversation with the individuals that actually live within these postcodes as to whether they'd use that service if you actually put it into play? How much would they be prepared to spend? How often would it need to run? What else would you need to do to get them out of their cars and onto this shuttle service, which will remove huge amounts of vehicles from your car park and also, of course, reduce emissions, reduce congestion and improve air quality? I'm just going to move on quickly to car sharing. And so what you're seeing on the map now, in the terms of green dots, are postcodes where I live within walking distance of at least 10 of my colleagues with whom I could share my journey to work. And we can break this down by shift. And again, very significantly, in this instance, 97% of staff had at least one person they could share with. 89% had at least 10 colleagues they could share their journey to work with. Now, we've undertaken this exercise for 1 million people plus across the UK for large employers, including many NHS trusts. And we found that 80% of those, 8 in 10 of that million, live within this pattern of being within walking distance of at least 10 colleagues with whom they can share. So huge opportunities there, but we want to understand hospital site by hospital site what that actually looks like, so we can actually put some actions and interventions into play. And finally, we also want to know about active travel. How many staff live within 30 minutes walking distance on infrastructure, not as the crow flies, to the hospital site? How many live within 30 minutes by bicycle? How many people live outside that region? If I just come out slightly, you'll see these huge groups of postcodes outside where maybe 6 miles, we're into 7, 8 miles is just too far to consider cycling. But if we introduced e-bikes, maybe working with the local authority, perhaps we can actually do something about changing those people, they're likely to be driving alone, to convert at least some of their journeys into arriving on an e-bike. But again, rather than just introduce it, let's talk to the people that actually live in those postcodes about whether they'd use such a service. So the whole point of scoping is threefold. Firstly, give senior management team a very quick understanding of the art of the possible in terms of what options already exist for staff, where gaps in services are, therefore which third parties do we need to start to talk to about mitigating those shortfalls, and what would success look like. So that's what we can give management team. Secondly, we give you as an organisation the power through this data to have informed conversations with third parties. And thirdly, it allows you to have very targeted conversations with your staff about modes of travel that are relevant to them. So long gone are the days, I hope, where we're just going out there saying, let's all cycle. Because if I live 40 miles away, that's not really an option for me. So that covers off the measurement phase. And then based on that, we then start to implement interventions. And those interventions could, for example, include a lift share for work platform. It could include deals with public transport operators. There may be interventions such as micro providers, e-bikes, e-scooters, and so on. And we've got a really good ecosystem where we can introduce you to different organisations doing those different things. We would also use personal travel plans. So this, I referred to them before in terms of recruitment, but actually you can send a plan proactively to every single member of staff, showing them the power of the tool, which is to show them all of their options, including people that they can share with that work for the organisation, but also public transport, walking, cycling, and so on, and the implications of their decision. We can also set up a portal where staff can go and help themselves whenever they want, because they might well be changing shifts or working hybrid, and they need different plans for different situations. And then finally, just moving forward beyond the personal travel plans and into lift share, part of what we do is establishing lift share platforms and communities branded to the site. And this enables staff to find, first and foremost, others that work for that organisation they can share with. If they choose to, they could look outside the organisation and share with others that might be working nearby. And we've got some really interesting approaches now to making this work successfully that have seen case studies where, for example, we've had 50% of staff confirm sharing within a few months. Now, that confirmed sharing is because we have another bit of software that allows staff to confirm by touching phones, QR code using the app, that they have shared a journey. That provides live data to the trust in terms of miles saved, CO2e reductions, financial savings for staff. Why would staff use this? Because actually it gives them access to car share spaces when they arrive at site, or we are actually introducing now a way of integrating this software with ANPR systems. So it gives trust the opportunity to do differentiated pricing at the gate. So if I've shared my journey, not only have I halved my costs at least of fuel, not only will I be able to get into a car share space that's waiting for me, but I can also pay less or perhaps nothing at all in order to get into that car park because I am sharing. And finally, I might even, every 5 times I authenticate, get a free coffee or a free lunch or something of that nature. So that's all I wanted to cover for now. I hope that's useful. Obviously, very happy to answer questions now. But as I mentioned before, contact details are here. Please do get in touch, and I'll obviously be really happy to look at your specific requirements and challenges and objectives in a lot more detail.
Fantastic. Thanks, Mark, for walking us through that and taking a break from your team away day to do that for us. It's really helpful. Really exciting to see some of the things you can do. So thank you very much. I haven't seen any questions or comments come up in the chat for you. If anyone does have any further questions, please do add them to the Q&A or chat. We will be following up on those after the event. We've got 7 minutes to spare, so if anyone wants to ask any live questions or has any comments for any of the speakers, please do come off mute and say what you want to say. If not, I will let you all depart this session. Please make sure that you look at the rest of the agenda for the day. Up next is 2 roundtable sessions for you to take a choice from, and then some more theme groups this afternoon. So please, do make the most of everything that's available today. Thank you very much for all of the speakers and for everyone that's joined. If there are no questions, I will wish you all the best of afternoons, and enjoy the rest of the day.
Lovely. Thank you, everyone.
Yeah, thank you.
Thank you.
Thanks, everyone.